Hi everyone, it's Dr. Hart. We're gonna deep dive into some of the most common problems that we deal as heart doctors in terms of heart rhythm abnormality. That is atrial fibrillation, AFib for short. AFib is by far the most common heart rhythm abnormality that we deal with on a regular basis. And the reason for this is our aging population and the abundance of risk factors for this irregular rhythm. There are good news and not too good news associated with atrial fibrillation. If you have been diagnosed with atrial fibrillation, you may already know this. The good news about it is not an immediately life-threatening heart rhythm abnormality, meaning it does not lead to sudden cardiac arrest, heart attacks, or things like that. The not too good news about it is that it does increase the risk of a stroke. And we'll explain here in a few minutes why is that. The other not too good news about it is that it has a propensity to come back despite you and your doctor doing the best to prevent that from happening. So what is atrial fibrillation? Atrial fibrillation is a chaotic heart rhythm abnormality coming from the top of the heart. So normally how the heart rhythm works is, I want you to imagine a two-story building, two rooms downstairs, two rooms upstairs, and an electrical generator on the roof. So that an electrical generator provides the electricity for the function of the whole house, the four chambers. And in this case, those four chambers are dedicated to pump the blood to the rest of the body. And they should do that in a coordinated manner. So if my hands were those pumping chambers, they should be doing this at the same time in a very coordinated manner. When they do that, we call that sinus rhythm, which doesn't have anything to do with the sinuses up here in the face, but that's how we call it. When the patient goes into atrial fibrillation, what happens is the pumping chambers on the bottom, called the ventricles, continue to pump as they usually do, but the ones on the top go quivering. So they are no longer contributing with the squeeze of the blood to move it forward through the body, and that quivering causes a stagnation, slow blood flow into the cavity, therefore promoting the formation of blood clots. As you may imagine, stagnant blood or blood that is moving slowly has a tendency to form blood clots. And that's how strokes are originated in this condition, because a little piece of those clots could travel all the way to the brain and damage the brain and cause all the symptoms of a stroke. What are the risk factors for it, or what are the causes of it? The causes of it, the number 1 and 2 causes of atrial fibrillation in our country are age. Typically above 60, 65 years of age is where the risk for AFib increases. The other big risk factor for it is high blood pressure or hypertension. But they're not the only ones. Thyroid disorders could cause atrial fibrillation. Problems with a very common sleep disorder known as sleep apnea could cause that. Obesity could cause that. Excessive alcohol use could cause that. Other heart problems like valvular heart disease, meaning malfunctioning valves that do not open well, do not close well, or blocked arteries or semi-blocked arteries, the so-called coronary artery disease, where the heart doesn't have enough blood flow, and that creates an irritation that leads to the irregular heart rhythm. So those are the main causes, and attacking those main causes is what could help with prevention. So if you have a family history of atrial fibrillation, or you have already been diagnosed with atrial fibrillation, the best things that you could do to prevent that from happening is maintain your weight at an optimal level according to your height. Avoid excessive alcohol, excessive caffeine, stimulants, and be tested for sleep apnea if there is any concerns with sleep disorders when the patient snores a lot or is constantly fatigued and dozing off through the day because they are sleepy all the time. Those are findings concerning with sleep apnea. So if you suspect that, get diagnosed, get treated for that, and control very well high blood pressure, because these are the main causes of atrial fibrillation. Now, once atrial fibrillation starts, it has a natural history where it starts being very infrequent, lasting just for a few seconds, and it is hardly detectable. Some people who are very in tune to their body may be able to feel that as a sensation of palpitation or fluttering, and that's when they seek medical attention. But other patients may have, a prolonged episode of atrial fibrillation. Is only when they get to the doctor that atrial fibrillation is diagnosed. So the best thing we can do is prevent it. If you already have it, talk to your doctor, talk to your cardiologist. It's very important that you protect yourself against a stroke by taking medications that thin the blood and prevent those blood clots from happening. And the second very important thing that you could do with the help of your doctor is control the heart rate, because you don't want the heart rate to be too fast or too slow. We want them right at the Goldilocks zone where the heart is most comfortable and doing his job comfortably. So with all this knowledge, I hope you understood clearly what atrial fibrillation is and what the risk is. Let's try to get this prevented by adopting good lifestyle conditions and habits, working with your doctor to detect early and treat that condition as described. Remember, be smart to take care of your heart.